Hi, you're listening to Season 4 of the Baby Manual podcast, the podcast that helps new parents all over the world navigate the everyday challenges that arise when you have a young baby. This season will help you decide which pregnancy, baby, and toddler items you actually need, and which ones are a waste of time and money. I'm pulling on the knowledge of hundreds of thousands of new parents around the world, other pediatricians, doctor moms, the Academy of Pediatrics, breaking pediatrics news sites, all to give you the best information and recommendations that I can, because I know how overwhelming it can be. I'm your host, a pediatrician, a mom, and an author, Dr. Carole Keim. Hello, welcome back. Today we are going to talk all about teething and feeding things that you should have for your baby. So teething typically happens around 6 months of age, but can happen anytime in the first year and a half of life. And it can be normal for your child to get their first tooth anywhere from 0 to 18 months of age. So you might want to have some of these teething things on hand even before your baby is born, in case they are born with a tooth or in case they get one very early on. So I had mentioned in our last episode about medications to have on hand, either some acetaminophen or paracetamol outside the US, or some topical teething ointment like Orajel or Anbesol, which is just a local anesthetic. Those can be really helpful to have for your baby if they're having a lot of pain from the teething. So if they're really fussy and they're not sleeping well and they're not eating well, and you can feel little bumps on their gums where the teeth are trying to break through, then those could be reasons to try some teething medication. As soon as your baby has a tooth, you're going to need to brush that tooth. So any toothbrush with soft bristles is good. And you can get a child-sized toothbrush. I usually recommend those ones for babies. And just start off brushing with water every day, twice a day if you can. That will help to prevent cavities. And especially for those babies that have really early teeth, they're a lot more likely to get cavities. So you do want to brush those teeth as soon as they come out with a toothbrush with soft bristles and water. After they're a year old, you can use toothpaste that has fluoride in it, but you're only going to use the tiniest amount that you can see, like just touch the toothpaste to the brush and pull it away again. So the equivalent of like a grain of rice at a time is all that they should have. And the fluoride will help the enamel on their teeth and it'll help prevent cavities. And if it's just a grain of rice amount, it is safe for them to swallow that amount and can even help for the teeth that are still coming in to get that fluoride into the enamel on those teeth and to help prevent future cavities, even in their adult teeth. So after a year of age, some fluoride toothpaste is good. You'll want one that is for children so that it's not like a spicy mint one that the adults use. Teething toys are great. I have some favorites. I really love that banana toothbrush, and we'll link that one in the show notes because it's great for them to chew on. It's a silicone toy. It has a couple different areas that they can chew on and has like sort of different textures and stiffness of the silicone. And you can also use it as a toothbrush if you would like. But yeah, babies seem to really love that one. And then I'll link a couple other silicone toys that I like for teething. There are a few different ones. And all of those are really nice just to have different textures for your baby to chew on. A bandana bib can be helpful when your baby is teething because it can help catch that extra drool. Some babies get really drooly with those front teeth. And so having a bib will help that, to protect their clothes and also so that they don't get so cold from all that drool dripping and making their clothing wet. If your baby's getting a drool rash, you could use some kind of a barrier cream for that. So something like Aquaphor or Vaseline is nice. It's just something petroleum-based to keep that skin from getting the drool on it so that it doesn't get irritated. And if they're starting to get a drool rash that goes all the way into their neck folds, then you might want to also consider an antifungal cream. So something like clotrimazole or terbinafine is great for that. And you can just put that in the creases. And if it's looking like really red and raw in there, or it's like pink with little tiny dots called satellite lesions around it, that can be signs that it's colonized with some yeast and it could respond to that antifungal cream. And also if it's not going away with the Aquaphor or Vaseline on there, it might be colonized with that yeast. So you could try that. Some teething crackers are nice, and those are usually rice flour based, and they start off crunchy, but then they immediately get soggy when they get wet. So those are safe for babies to chew on, and they can feel really good for them to chew on, and then they'll just like suck on it and it'll dissolve in their mouth and they can swallow it and not be a choking hazard. So some teething crackers or rice rusks are really good. Things that you don't need. So the homeopathic teething tablets I found are not super helpful. And it's several years ago now, but there was a recall on the Highlands brand teething tablets because some of them were contaminated with belladonna, which it actually was implicated in the death of several children. So I don't recommend those homeopathic teething tablets. You don't need a baby toothbrush necessarily, just any child toothbrush is fine. And I really don't like those finger toothbrushes, like the ones that go over your finger to brush your baby's teeth, because as soon as they're teething, they start biting and they will bite your finger and it hurts. So I don't like those ones very much. Also, you don't need practice toothpaste. I've seen a lot of baby toothpaste that's fluoride free, and it just isn't really helpful. I think the idea is to get them used to having toothpaste, but it's not doing anything for them or for their teeth. So just brushing with water until they're able to use fluoride toothpaste is the best. They don't need dental floss yet because their teeth aren't usually touching each other. And, once they get older and they start to have all of their teeth, you can start flossing. Also, mouthwash is something that you can't use until kids are old enough to spit, which is usually a few years of age. So you don't need anything like that for them. There are wooden teething toys available, and I don't usually like those just because they can, over time, get splintery. And, you don't want that. You don't want splinters in your baby's gum. I like the silicone ones a bit better for that. I've seen these teething mitts, which are something that it looks like a mitten with some rubber or silicone on it for your baby to chew on. Those don't stay on super well. And from what I found, my children and children in my practice just don't seem to really like them very much. They're usually kind of heavy too for them, so don't usually recommend those. And you don't need an amber teething necklace. So amber is thought to have succinic acid in it, which is anti-inflammatory, but studies have shown that not enough of it gets through the skin to actually have anti-inflammatory effects. It's more of a homeopathic thing. So the amber teething necklaces, they're not for chewing on. They're meant to be worn and supposed to be anti-inflammatory. They work in sort of a homeopathic way. Some parents have told me they felt like it really helped a lot, but I feel like overall they don't really do that much and could potentially be dangerous because if the baby bites off one of the beads, they could choke on it, or if the necklace gets caught on something, they could strangle from it. So we usually recommend against amber teething necklaces. For feeding stuff, once your baby is 6 months of age or older, you can start feeding them some foods. And I like to have a bowl that has a suction cup on the back of it to put the sort of purees or rice cereal if you're doing that in, because those will stick to the table and babies just love to grab stuff and dump it and throw it. So if it's got a nice suction on the back, I'll link those ones that I like that have a good suction cup on them. Those can be really helpful to have. They also sell these things that are a plate and placemat in all-in-one, and those are silicone, and those do also stick to a flat table. So if your baby's eating at the table with their high chair, then you could get one of those, and those stay still really nicely. And they usually have 3 or 4 segments in them for different things. So once your baby's old enough to pick up foods and put them in their mouth, they like to have things separated like that, and then they can, pick the foods out themselves without dumping it on the floor. A high chair is something that you'll need once your baby's able to sit. There's a couple of different kinds of high chairs you can get. There are some that have trays on them. There are some that just pull up to the table without a tray. And then there are some travel ones that you can put on the floor, or you can clip it to a chair. And it has 2 clips, one that goes around the back of the chair and one that goes under the chair. So any of those can work. All high chairs are pretty much created equal. Just find one that's easy to clean because it's going to get gross, and one that you just feel like looks nice in your house. Any of those, just personal preference, are fine. Some really small spoons and forks can be helpful when your baby's first learning to eat. Not the child-sized ones, but the really, really small ones that are made for babies. And I can link some in the show notes here. I like the newbie spoons because there's 3 different ones, and those can pick up liquids in that are of different textures, but also can work as teething toys for them. They're plastic that's then coated with silicone. And I can also link a baby spoon and fork set that I liked because it was really, really short and small and easy to grip. Like it was wide, so my baby could really hold on to it well and start to use that. They're not going to be using spoons and forks themselves when they're first eating, but somewhere between 9 and 12 months of age, they can start using that or trying to use it. Water bottles are nice. And your baby can start having water once they start eating food. I usually recommend offering 1 ounce of water for each ounce of food that they eat. They don't necessarily have to drink that much, but you don't need to offer any more than that to them. And you can just give them water in a regular bottle, like a baby bottle. But also, if you wanted to get a water bottle, my favorite one is the Camelback. And just because it has this nice silicone thing at the top to suck on, it doesn't come out super fast. It has like a nice flow to it. And your baby can suck on it while it's sitting down. Like they don't have to tip it up to drink out of it. You can also do sippy cups. And there's a couple of different kinds of sippy cups. There's the kind that has like a magic ring or 360 ring around the top. And they suck on it just like they would on a regular cup. But that silicone ring keeps the water inside of the cup so that it doesn't spill out if they throw it or dump it. And you can also just do open cups, like plastic or silicone cups or metal even. But your baby will probably throw them. So not glass, not ceramic, because those can be dangerous. But, small cups that your baby can hold are good. And I actually had a pediatric therapist tell me that she recommends those little shot glasses that are the Solo Cup brand. They're just 1 ounce each, and they're really small and they're really easy for babies to pick up. The only downside with that is they're disposable, and if your baby squeezes it, it can crack and break, and it can also be sharp if it cracks. So use with caution if you're doing those ones. And then you'll need some bibs, of course, for your baby to keep their clothing clean. If you don't mind them getting dirty, I guess you don't really have to have a bib, but it is nice to have a bib. And they also make these bib shirts that I really love. And those are great because it's just, it has sleeves that go all the way down to their wrists. And it also has a pouch in the front to catch any food that falls. So I found that the bib shirts are the most helpful for babies who are starting to feed themselves in terms of keeping them clean. Things you don't necessarily need. You don't really need plastic bowls, plates, and cups other than those ones that stick down, just because, like I said, the kids will likely take them, dump them, or throw them. So anything that's not stuck down like that is just plastic, they probably don't need. You don't need kid-sized plastic utensils. Once they're old enough to use utensils, they could use regular ones. You can do plastic if you're worried about your child like poking themselves in the mouth with a fork, but generally you can just use normal utensils once they're big enough for utensils. So pouches, they make pouch food or reusable pouches that you can fill with your own food. Those tend to be very messy because babies don't really understand the concept of squeezing gently and putting it in their mouth. Sometimes they'll squeeze it while it's in their mouth and just get too much and spit it out. Sometimes they'll squeeze it when it's out of their mouth and it just goes everywhere. So I'm not a huge fan of pouches. Those can be good for toddlers, but again, they don't really need them. They're not great for oral motor development. But if you have a kid that loves pouches, it is okay. It is an option to have baby food on the go. But yeah, for little ones, especially the younger babies that aren't feeding themselves yet, if you do pouches as like a portable form of baby food, you can just squeeze it into a bowl and then feed it to them with a spoon. You don't necessarily need to buy baby food. They do make baby food for different stages, like purees and tiny cut up pieces for them to pick up. You can also just give them normal food. And I'm a big fan of babies eating actual food. So whatever you're having for dinner or lunch or breakfast, you can just, when they're really small, you can puree it and blend it for them. Or if you're doing baby-led weaning, you can cut it up into pieces that are safe for them to eat and they can feed themselves that way. So just regular adult food is fine for babies. Remember that babies who are less than a year old cannot have anything that contains honey, even stuff that's cooked with honey, like Honey Nut Cheerios or honey graham crackers or honey ham or honey mustard. Anything with honey in it for babies less than a year is not recommended because there's a risk of botulism. But over a year of age, they can have things with honey. And then also babies who are less than a year should not be drinking straight cow's milk. It's okay for them to have milk-based products, and it's good for them to have things like cheese, butter, yogurt. But once they're over a year, they can start drinking cow's milk. They don't really need it, and there has been a push to move away from cow's milk by pediatricians lately, just because milk is really filling and doesn't have a lot of good nutrition in it. I mean, cow's milk is made for baby cows. It's not really made for baby humans. So it's a good source of protein and calcium and fat, but you can find protein, calcium, and fat in just about everything else. So if they're eating a good varied diet, they really don't actually need milk ever. And rice cereal or oat cereal are two things that we're also starting to move away from in the pediatric community. I like rice cereal as a first training food just because you mix it with breast milk or formula and it doesn't have a lot of flavor. So it really just has texture to it, and you just mix enough to get it to the texture of mashed potatoes, and you can feed it to them. And you can see if your baby's ready to start having solids by trying with that rice cereal. I've seen a lot of kids with rashes from oat cereal, like eczema or diaper rashes after eating the oat cereal. I usually don't recommend oat cereal at all. And the rice cereal just really as a practice food. And then once they're able to eat foods, you don't necessarily need that anymore. One thing I did with my rice cereal once my baby was eating foods is I would mix it with things that were a little bit more liquid, like yogurt, just to make it thicker and easier for them to pick up and, use a spoon to eat. But yeah, you don't really need to keep buying rice cereal, maybe just like a one-time purchase to try out, or not even at all. It's okay to start with just regular foods. All right, I hope this was helpful for teething and feeding. Check out the other episodes in this season and also earlier in this series. Season 1 is all about the first year of life, and there is an episode on feeding and teething in there. Season 2 is for ages 1 to 3, and I talk about picky eaters in that one. And then season 3 is all holistic and alternative things that you can use for your children for if they're not feeling well. I hope this was helpful. Next time, we're going to be talking about apps and electronics. Thanks for listening. Remember, all of the links from this episode are in the show notes, and you can always go to my Linktree, which is linktr.ee/DRKEIM. If you know anybody who is pregnant or has a little baby, tell them about this show. Maybe they would like to listen to this podcast. They might find something helpful in here. And if you know any friends who are pregnant and want to get them something for their baby shower, I would definitely recommend my book, The Baby Manual. It's meant to be all-inclusive. Really, all the questions that arise in the first year of your baby's life are in that book. So Baby Manual is also linked in the show notes and on my Linktree. Have a wonderful day.